This is Matthew, a nurse from Med-Surg Unit, calling a report on Millie Larson. She is an 84-year-old Caucasian female admitted to the hospital with a UTI, which has resolved at this time. She is currently on contact precautions for MRSA to her sacral wound. She has a past medical history of hypertension, glaucoma, hyperlipidemia, osteoarthritis of the knee, osteoporosis, stress incontinence, and diabetes. She has a daughter, Dina, that lives nearby and that is her major support system since her husband's passing a year ago. Several weeks prior to this admission, she was in the hospital and admitted for flu and dehydration. She has several hypertension medications along with anti-diabetic meds and diuretics for her home medications. Ms. Larson has become increasingly confused since her admission to the Med-Surg floor. She has a poor PO intake, only consumes about a quarter of meals with encouragement. Increased weakness is also observed and much needed encouragement to get out of bed. She has developed a fever of 102 with some productive coughing and difficulty breathing, and new orders for Tylenol 650 milligrams, Q6 hours, PRN fever for a temp greater than 101 degrees Fahrenheit. Sputum and blood cultures were obtained along with a CBC, which showed an elevated white count of 22,000. Chest x-ray ordered and positive for a hospital-acquired pneumonia. Respirations are currently 26. She has rhonchi present with crackles throughout. O2 via nasal cannula at 6 liters per minute to keep saturations above 92%. New orders for a respiratory treatment, which the RT has given. Her blood pressure is currently 98/66 with a heart rate of 60. The patient is receiving IV fluids of normal saline via her peripheral IV at 100 mL per hour. The doctor has also ordered IV Cipro, 400 milligrams, IV Q12 hours, and the first dose has been given. She has a Foley catheter in place that is draining clear yellow urine, and so far she has had 200 ml output. She has orders to monitor strict INOs. She has so far received 300 ml of normal saline via IV and 50 ml of fluids via PO. She remains lethargic. She also has new orders for Toradol, 30 milligrams, IV, Q6 hours, PRN pain, but has not received any at this time. She is being transferred up to the special care unit for close observation of her new acute onset of symptoms.